Professor Jane Gilgun. In this video, I discuss how parents and others who care for children can tell the difference between appropriate and inappropriate childhood sexual behaviors. Here's the scenario. You walk in on two children, one's 4 and one's 5, one's a girl and one's a boy, and they're touching each other's genitals and giggling. What do? Is this appropriate or inappropriate? And the first question you want to ask is one child forcing another? You can tell by how they're acting. Are they both kind of giggly? Are they a little bit embarrassed, when you show up? Are they about the same age and size? If the children are giggly and a little bit embarrassed and seem to be interested in what they're doing, then this is simple sexual exploration, and there's no reason to be upset or concerned. You simply can say to the children, I can see that you're interested in each other's bodies and you probably have a lot of questions about them, so why don't you get dressed now and we can have a talk about boys and girls and their bodies and the differences between boys and girls. When you come upon a scene like this and see that one child is upset or distressed and the other child seems to be forcing himself or herself on this other child, then there is reason to be concerned. If the child is bigger, stronger, older, appears to be using threats or force, then this is inappropriate sexual behaviors, and you really need to do something right away, like say, you're going to have to stop this right now. Here are some examples of inappropriate sexual behaviors. A 13-year-old girl who is taking care of younger children has the children undress and she touches their genitals. This is inappropriate sexual behavior, and even if the younger children enjoy the attention, the chances are very good that they feel forced and they feel strange and they feel as if they didn't really have a choice in the matter. And so the girl needs special attention, and so do the two children. Another example of inappropriate behavior, and I hope this is obvious, is that when one or more children stick objects into the sexual body parts of other children. This is inappropriate sexual behavior, and parents and others who take care of children have to put a stop to it immediately. But the children who have been acted upon, as well as the children who have been sexually aggressive, require special care. Children who have been sexually aggressive require the help of a professional. Parents and other care providers really don't have the expertise to deal with it. Sometimes children who act out sexually with other children require relatively brief treatment with professionals. This can be several weeks of psychoeducation about human sexuality, some family therapy, some education of the parents about how to handle the children's sexual acting out. Now, this is for children who don't have histories of trauma of various sorts and who simply don't understand that this behavior is inappropriate. Some children who act out sexually, however, may have deep-seated trauma or may have trauma that nobody is aware of. The kinds of trauma that children who act out sexually sometimes have include sexual trauma, such as being sexually abused, or other forms of trauma like long-term neglect or physical abuse or parental abandonment or deaths or other kinds of things that the kids really can't cope with, but nobody's helped them with either. They are not necessarily sexually abused, they're simply traumatized, and they come upon sexual behavior as a way of helping them feel better. And they may need long-term therapy and education about sexuality and boundaries and all kinds of other things that are related to their sexual acting out. Group treatment for children, group psychoeducation, family therapy, couples therapy, and individual therapy for the children, individual therapy for the parents often is crucial for the children to learn how to manage their sexual behaviors and to work through the other issues that are related to their sexually aggressive behaviors. Parents often find that without realizing it, their own issues, the problems they may have between them, their own unresolved history of trauma may be playing into children's sexual acting out and other behaviors that the children have. So parents really have to become involved in their own work in making their own lives better so that they can become more psychologically and emotionally available to their children and able to guide children on how to behave in sexually appropriate ways and how to be appropriate overall. So even when children have problematic sexual behaviors, it's not the end of the world. What is required is parents who are willing to work on their own issues, parents who are willing to do whatever it takes for their children, and for parents to encourage their children to participate wholeheartedly in a range of treatments that the children may require in order to develop more appropriate sexual behaviors. It's important to remember that children do experiment sexually. When it's true experimentation, it's fun for the children, even though they might be a little bit embarrassed. They may giggle and laugh about it, and it's over very quickly.